Hi. Hi, guys. My name is Sanjay Gupta. I'm a consultant cardiologist in York Hospital. And I was keen to do a little video blog tonight. Since I've joined the groups on Facebook, I've started realizing how troublesome palpitations are, how troublesome ectopics are. I've always maintained that it's something that we take, our lifestyle, that contributes in a big way. One of the interesting things that arose in my mind is the question of proton pump inhibitors. Now, when I see patients in my clinic now, I am always struck by how many people are on proton pump inhibitors, lansoprazole, omeprazole, for gastric reflux. So gastric reflux is a really common thing. And I would say 8 out of 10 people that I see in my clinic are on proton pump inhibitors. And we also know that reflux can cause palpitations, can cause heart rhythm disturbances. But the other question then arose in my mind is, could proton pump inhibitors in some way contribute to palpitations and cause heart rhythm disorders? Because so many people are taking proton pump inhibitors, you have to ask yourself, could it be that? And in fact, a couple of the members on one of the Facebook page were asking today about the risk of heart attacks with proton pump inhibitors and how people are advising them as to whether they should be coming off the proton pump inhibitors, etc. So I started getting interested in looking at this, and I did a little bit of research today, and I just wanted to share it with you because it's interesting, and it may give further insight into why some people get palpitations. But essentially, proton pump inhibitors are widely used for the management of gastric acid secretion, so duodenal ulcers, gastric ulcers, reflux, hiatus hernias. Okay, they were first introduced in 1980s, and then in 2006 there were 2 patients developed severe hypomagnesemia, so a reduction in their magnesium levels, along with hypocalcemia and hypokalemia, so a reduction in magnesium, reduction in calcium, and reduction in potassium, whilst being on long-term treatment with a proton pump inhibitor. And as soon as the proton pump inhibitor was removed, they stopped taking the proton pump inhibitor, the hypomagnesemia got better. So then a lot of people got interested in this, and they started doing various studies. And there are no randomized placebo-controlled studies. So a lot of studies are case control studies. A lot of people are, a lot of this is case reports, okay? So whenever you're dealing with research, you have to obviously bear in mind that they're not like really robust, hardcore studies, but they can give some insight into what's going on. And so there were 14 case control cross-sectional studies that have been done, okay? And an association has been found between low magnesium and proton pump inhibitors in 10 of them, okay? And so it is generally thought on the basis of this that proton pump inhibitors may cause a reduction in magnesium levels. And if you measure the urinary magnesium is also reduced, which suggests that there may be a problem with the absorption. They may be blocking the gut absorption of magnesium, okay? And we find that this is more prevalent, this problem is more prevalent in people who are on diuretics, because diuretics secrete magnesium, so you lose more magnesium. Also in patients who are on cisplatin, carboplatin, and people who have bad kidneys, but diuretics in particular, okay? And what they find is that generally it's patients who are above the age of 50 and who have been on proton pump inhibitors for over 1 year. And if you're on loop diuretics or thiazides, if you drink excessive alcohol, then you're more likely to have it. It is often accompanied with reduction in calcium levels and reduction in potassium levels and reduction in the parathyroid hormone levels. Now, when you increase your magnesium intake, it does not appear that the low magnesium levels improve. And that is because the proton pump inhibitor is reducing the absorption of magnesium from your stomach. So taking oral magnesium doesn't help, but taking intravenous magnesium does correct the magnesium. Now, if you discontinue the proton pump inhibitor, then the magnesium levels start normalizing after about 4 days. If you then switch the proton pump inhibitor to another proton pump inhibitor, then you start developing the magnesium deficiency again. Okay, so you may then say, well, what is the option? Because if I have this bad reflux, I can't do without the proton pump inhibitor because my reflux will flare up, and reflux is bad because it causes inflammation. And that can make my ectopics worse. So how do I get around it? And what they found is that there are other anti-reflux medications. These are the histamine type 2 receptor antagonists. They're like ranitidine. And interestingly, hypomagnesemia does not occur with ranitidine. Okay, so it's just worth bearing that in mind, that if you've been on proton pump inhibitors long term, if you're also on diuretics, and people often take diuretics because they have high blood pressure, or they have swelling of the legs, etc. It may be worth just going and speaking to your GP, asking him to do your urinary magnesium levels, checking your calcium and your potassium and your magnesium, and if those are low, then it may be worth asking him, can I come off the proton pump inhibitor and instead go on something like ranitidine? And you should start noticing a change in about 4 or 5 days. And that may explain why sometimes dietary magnesium doesn't help for people. So some people have written to me and said, well, I've tried the magnesium, it doesn't work. Worth finding out, do you take a proton pump inhibitor as well? Have you been on a proton pump inhibitor for a long time? And if you have, then that could be another thing. So this is just, I'm not suggesting that this is the absolute reason, but I do think it's worth just bearing that in mind. And when you're looking for possible causes of why you're getting palpitations and why they're not getting better, it may just be worth bearing in mind the fact that if you're on a proton pump inhibitor, this can influence things in that way. All right, so it's late again and I'm exhausted. So I'm going to head to bed, but I will tomorrow, I promise, try and answer some of your questions. And one of the group members is particularly anxious and is having a lot of ectopics. And if you send me a PM on Facebook, I will try and help you. So I hope you like this video. It just throws some interesting insights. I would like to do a video soon on mitral valve prolapse, and I'll try and get that done in the next couple of days. All right, so all the best. You can contact me, as always, on yourcardiology.co.uk. My secretary's number is listed. You can contact me via Twitter and, of course, on Facebook. So all the best, and I wish you a good night. Bye.